Many parents have this confusion always going on in their mind whether to go for a government vaccines and whether to go for a private vaccines. Hello everyone, myself Dr. Shraddha Shikre. I am a consultant pediatrician and neonatologist in Pimpri Chinchwad, Pune. In this video, today I will try to clear all of your doubts regarding the government vaccinations and the private vaccinations. Many parents have the wrong mindset that only the government vaccines are sufficient and the private vaccinations are not at all required. So I will try to clear all your doubts and give you very important clear insights in this video. So do watch this full video and share to the needy parents as well. In government hospitals, the National Immunization Schedule vaccination program is followed, where the vaccination is given against very few life-threatening illnesses only, while in private hospitals we follow the Indian Academy of Pediatrics vaccination guidelines. Vaccines that we give in this schedule covers all the diseases that are covered in the government schedule, plus some of the other essential vaccines are also given, which are very important to be given. As due to the cost issue, in a big populous country like India, government cannot give all the vaccines to all the kids free of cost against all the diseases. You need to take some of the very important essential vaccines from the private hospitals only. So there are these 8 vaccines that you need to take from only and only private hospitals. These are flu shots, MMR vaccine, typhoid vaccine, meningococcal vaccine, Japanese encephalitis vaccine, hepatitis A vaccine, varicella, that is chickenpox vaccine, and HPV vaccine. Also, if you want to take the combination vaccine also in a painless form, that is DTAP form, you need to take from the private hospitals only. As in government hospitals, their DTWP, that is painful pentavalent vaccine or a DTP vaccine, is given. So this is the major difference between the government vaccines and the private vaccine. So if you want to protect your child completely with the best possible vaccines with a broader coverage, talk to your pediatrician and go for private vaccinations. But if cost is an issue for you and you cannot afford to give vaccinations in a private hospitals, you can give the government vaccines initially, and later on we also can follow the catch-up immunization schedule and complete your kids' private vaccinations as well. And all these vaccines are very safe, effective and painless vaccines. Some parents do take all the vaccines from private hospitals from the beginning only. Some parents start the immunization in the government hospitals, and if their baby gets any of the allergic reactions due to the painful vaccinations there, then they switch over from government vaccines to private vaccines. Some parents give the basic available vaccines in the government hospitals, and the additional vaccines they cover in private hospitals. That is also acceptable. We follow the catch-up immunization schedule most of the times and we complete the vaccinations, where the protection starts from the date we give the vaccines. Every year the guidelines somewhat change about the vaccinations. So always talk to your pediatrician first. He or she is the best person to guide you about the latest protocols of the vaccinations. Now I will tell you age-wise which vaccine is given and which vaccine you will get in government hospitals and which vaccines you need to take in a private hospitals. At birth or soon after the birth, mostly in the maternity home itself, your baby gets 3 vaccines. Number 1 is BCG vaccine, that gives your child protection against the tuberculosis and the extrapulmonary complications of the tuberculosis. Number 2, oral polio drops, that gives your child protection against the polio virus. Number 3 is hepatitis B vaccine, that gives your child protection against the severe liver disease that is caused due to the hepatitis B virus. So all these 3 vaccines are life-saving vaccines, and you can get these vaccines in the maternity home itself, or in the government hospitals or in the private hospitals. At 6 weeks, 10 weeks and 14 weeks, your child receives combination vaccine on one leg, the pneumococcal vaccine on the other leg, and orally oral polio drops and oral rotavirus vaccine. In government hospitals, there the pentavalent painful combination vaccine that contains DTWP that gives protection against diphtheria, pertussis and tetanus, hepatitis B and Hib, that is H influenza B, is given. But please note, the fractional dose of the injectable polio is given as a separate injection in the government centers. As this vaccine is a painful vaccine due to the DTWP, that is pertussis component, as it is in this vaccine, there are high chances of your baby getting the severe pain, the swelling and the high grade fever. In private setup, we can give the Painless, that is DTAP combination vaccination, and we can give the hexavalent vaccine, which includes DTAP, hepatitis B, H influenza B and the full dose of injectable polio. So, in private combination vaccine, the injectable polio is included in the same syringe itself. You do not need to take the separate injection for the polio. So your child receives the protection against 6 major illnesses in a single shot only. Along with both of these vaccines, the oral polio is given, the rotavirus vaccine is given. So with the private vaccinations at 6, 10, 14 weeks, the chances of pain, fever, swelling are pretty lower. So this is the major difference between the painful vaccine and the painless combination vaccine. I have made a separate dedicated video over the painless and the painful vaccinations. Please go through it for the better understanding. In private hospitals, you can give the broader coverage PCV vaccine that covers more germs. And at 6 months of age, there is no vaccine that is given in the government. But in private hospitals, we give the first dose of the flu vaccine, oral polio vaccine, and the typhoid vaccine also can be given from 6 months to 9 months. Flu vaccine gives protection against the major seasonal epidemics of the airborne diseases that are responsible for the recurrent cold, cough, fever in children. So at least till 5 years of age, it is very important to take the flu vaccine every yearly. I have made a separate dedicated video on the flu vaccinations. Please go through it. That will give you a complete understanding of the flu vaccinations. While the typhoid vaccine gives your child protection against the typhoid. So both of these vaccines, that is flu vaccine first dose and the typhoid vaccine, are private vaccines and they are painless vaccines. Now when the baby gets 7 months old, we give the flu shot second vaccine, which is again a private and a painless vaccine. Now at 9 months, in government hospitals, your baby can get MR vaccine, that is measles rubella vaccine, along with oral polio drops and vitamin A oral dose. While in private hospitals, we can give the child MMR vaccine instead of MR vaccine. MMR vaccine gives protection against all the 3 illnesses, that is mumps, measles and rubella. Please note, the vaccine that you get in the government, that is MR vaccine, does not give you protection against the mumps. If you want a complete protection against all the 3 diseases, you have to take the MMR vaccine in a private hospitals. Also, oral polio and vitamin A we give here also in the private hospitals. One more important vaccine that we can give in the private hospitals at 9 months of age is MCV vaccine first dose, that is meningococcal vaccine. The meningococcal vaccine gives your child protection against the meningococcal meningitis, which is a bacterial cause of the brain infection. At 1 year of age, no vaccine can be given in a government hospitals, but in private hospitals we give 2 very important vaccine. Number 1 is hepatitis A vaccine first dose. Number 2 is Japanese encephalitis vaccine first dose. Hepatitis A vaccine gives your child protection against the liver disease caused by the hepatitis A virus. If you take the live vaccine of the hepatitis A, only the single dose is sufficient. If you take the kill vaccine of the hepatitis A, then the second dose of the vaccine is given when the child turns 18 months of age, that is roughly 6 months after taking the first dose of the vaccine. And Japanese encephalitis vaccine will give your child protection against the brain infection caused due to the Japanese encephalitis virus. Again, both of these vaccines are very important to be taken, and they again are a private and painless vaccines. Now at 13 months, again there is no vaccine that can be given in a government hospitals. Now in private hospitals, we give two vaccines to the child. Number one is Japanese encephalitis vaccine second dose and the meningococcal vaccine second dose. Again, both of these are private vaccines and painless vaccines. Now at 15 months of age, in government hospitals, you can get the MR vaccine second dose, while in private hospitals we give three vaccines to the child. Number one is MMR vaccine second dose, number two is pneumococcal vaccine booster dose, and number three is chickenpox, that is varicella vaccine first dose. The chickenpox vaccine gives your child protection against a very common disease in India, that is a chickenpox. Again, all these three vaccines are painless and given in a private hospitals only. Please note, in government hospitals, if PCV booster is available, then they give it when the baby gets 1 year of age. Most of the times it is not available there, so parents can take it from private hospital as well. Then at 16 to 18 months of age, in government hospitals, baby receives the painful DPT vaccine along with the oral polio vaccine, while in private hospital, we give the painless pentavalent or a hexavalent combination vaccine along with the oral polio. Now at 18 months of age, again there is no vaccine that can be taken in a government hospital, but in private hospitals, we can give the hepatitis A vaccine second dose and the chickenpox vaccine second dose. Again, both of these are painless and private vaccines, as I mentioned earlier also. Now at 2 years of age, there is no vaccine that can be given in a government hospitals, but in private hospitals, we can give the MCV vaccine, that is meningococcal vaccine. If not taken early, you can give the MCV vaccine to your child single dose of the vaccine now. At 2 years of age and above, only the single dose of MCV, that is meningococcal vaccine, is effective. And the second vaccine is typhoid vaccine booster shot. Again, both of these vaccines are painless and private vaccines. Then at 4 to 6 years of age, again in government hospitals around 5 years of age, there they give the painful DPT vaccine booster shot along with the oral polio vaccine and the MR vaccine booster shot, while in private hospitals we give the painless pentavalent or a hexavalent combination vaccine booster dose and the MMR vaccine third dose. Now at 8 to 10 years of age, in government hospitals at 10 years of age, you can get the TD, that is low dose tetanus and diphtheria vaccine, while at private hospitals we can give the TDAP, that is tetanus, diphtheria and acellular pertussis booster dose vaccine, which gives the child boost up immunity against all the three diseases, that is diphtheria, pertussis and tetanus. Again, this is the painless vaccine that we take in the private hospital. Now at 9 years of age, there is no vaccine that can be given in a government hospital. Now in private hospitals, we can give the child 9 years onwards HPV vaccination, which is a very important vaccine that gives your child protection against all the diseases and carcinomas caused by the HPV virus, that is human papilloma virus. I have made a separate dedicated video over the HPV vaccination. Please watch it for the detailed information. Nowadays there is a little bit variations in the protocols that are followed every year. So your pediatrician is the best person to guide you about the vaccinations. So go and check your kid's immunization record, see what all vaccines you have given to your child, what all vaccines you wish to give now. We can guide you for the same. We can follow the catch-up immunization schedule, and we will try to complete your kid's vaccination schedule on time. So if cost is not an issue for you and you want to give to your child the bestest immunity and the best health, then please go for private vaccination, as the bestest of health and immunity is the most precious gift that we can offer to our children. Please do not skip vaccinations against the vaccine preventable illnesses, as vaccinations are life-saving measures. Now, if your child is all good, not having any ongoing illness, please do not skip or postpone your kids' vaccination without any obvious reason, as you may expose your kids unnecessarily to life-threatening diseases, which are vaccine preventable. One more very important point I want to highlight here in this video, that nowadays we come across that parents do take the vaccines from anywhere, any agency or any of the unprofessional workers are giving the vaccines. They do not have any knowledge about the vaccination. They do not know the latest protocols. They do not know how to maintain a proper cold chain of the vaccine. So there is a big issue over the efficacy of the vaccine. Just they offer some of the lower costing, and parents go and take the vaccines there without even asking their pediatrician. So as far as the vaccinations are concerned, please do not take risks and take them from the authentic sources only. If you have any further queries regarding the vaccinations in general, or the painless vaccines, or the painful vaccines, or the government vaccines, or the private vaccines, you can reach out to us. We will be very happy to help you. Thank you.